baby in the uterus, okay? So the baby is inside the uterus. Let me get another one now. Okay, another baby.
In this video, I will cover the ins and outs of all methods of contraception. Starting with the most effective ones, the implant is a small rod that can be inserted under the skin. It contains progestin called etonogestrel. It has a failure rate of 0.05% and can last for 3 years. Its main mechanism of action is inhibition of ovulation. It can cause irregular bleeding, breast pain, and headaches. At the site of insertion, patients can develop bruising and hematoma. Rarely, the rod can migrate to other places in the body. The levonorgestrel intrauterine device has a high success rate with failure risk of less than 1%. It lessens the amount of blood loss during menstrual periods. There are a few on the market with a duration of action lasting between 3 to 8 years. It thickens the cervical mucus, making it impermeable to sperms. Side effects include headache, nausea, and breast tenderness. The expulsion rate is about 2 to 10%. And the perforation rate is about 1 in 1,000. The copper intrauterine device also has a failure rate of less than 1% and lasts for 10 years. Its main mechanism of action is inhibition of sperm migration and viability. It can also lead to heavy periods and pain. It has expulsion and perforation rates similar to the other intrauterine devices. Although several options are available for surgical sterilization with high success rate, the preferred one these days is bilateral self-injectomy as it decreases the risk of ovarian cancer. On the other hand, vasectomy is safer, more efficient, and can be done under local anesthesia. It requires a semen analysis after the procedure to confirm azoospermia. The contraceptive pills come in 2 forms. The first one is combined, which contains estrogen and progestin, and the other one is the mini pill, which contains only progestin. Failure rate ranges from 1 to 7% depending on the use. It can cause headaches, breast pain, irregular spotting, but overall they regulate the menstrual periods. They are contraindicated if the patient is over the age of 35 and is a smoker, if there is a history of deep venous thrombosis, migraine with aura, or if the patient has hypertension. The contraceptive ring also contains estrogen and progestin. Its side effects, success rate, and mechanism of action are similar to the oral contraceptive pills. It works by inhibiting ovulation. It is inserted for 3 weeks and then removed for a week. The contraceptive patch contains estrogen and progestin. It is applied on a weekly basis for 3 weeks. It has a slightly higher failure rate than the pill, but similar side effects. The barrier methods include condoms, diaphragms, and cervical caps. Combined, they have a failure rate of about 5 to 15%. Only the condoms protect against sexually transmitted infections. The fertility awareness and withdrawal methods are not very reliable, with a failure rate of more than 20%. Breastfeeding can be used as a method of birth control up to 6 months. It is important to talk a little bit about emergency contraception. The first option is ulipristal acetate. It can be given up to 5 days after intercourse. It can cause nausea, breast tenderness, and irregular bleeding. The levonorgestrel can be given up to 3 days and can cause irregular bleeding. And lastly, the copper IUD can be given up to 5 days after intercourse, but it also has the advantage of providing contraception for a longer period. If you want to support this channel, please like and subscribe. Click on the bell to be notified when a similar video is posted. Feel free to share and see you next time.